Welcome. Welcome to Life After Work. I'm your host, Dr. Clark Gaither. Life After Work is the source, the tool, the solution for redesigning and transforming your life when your life's work, for whatever reason, has come to an end. Today I left the Olympic Stadion in German, outside of Garmisch, Germany, and I'm hiking to Mittenwald. And I'm passing a lake with a beautiful mountainscape right next to it. It's truly beautiful here, absolutely beautiful. It's about I think 17-kilometer hike. I gained somewhere around 900 meters in altitude during the hike, but it's quite beautiful. So today I want to talk about a health concern. This probably should be at the top of everyone's list in terms of self-care. It's a health-related issue that can lead to ischemic heart disease, acute MI or myocardial infarction, which is heart attack, or it can lead to stroke. And that medical issue is hypertension. A lot of older adults develop hypertension as they get older. Their arteries aren't as elastic as they once were, and that increases the peripheral resistance that the heart has to pump against. Long story short, that elevates the blood pressure. And today, blood pressure, the medications for treating blood pressure are very good. There are two classes that most physicians start with. And those are the ACE inhibitors, the angiotensin converting enzyme inhibitors, which are very inexpensive and work well. Some few percent of people get a condition called angioedema from ACE inhibitors. That's swelling of the lips, tongue, can be the hands or ears, but mainly the lips and tongue. It's temporary, it goes away. You just have to stop the ACE inhibitor and treat with Benadryl. But there's a 20% or 1 in 5 incidents of cough with ACE inhibitors, where people will actually develop a tickle in their throat, and they're constantly trying to clear a sensation of something being in their throat, or it can be a frank cough that's very annoying. And 1 in 5 people who take ACE inhibitors get that cough. Once you stop the ACE inhibitor, the cough goes away. But for 80% of people, ACE inhibitors are very inexpensive and they work very well. The next class of drugs that really revolutionized the treatment of hypertension are the angiotensin receptor blockers, or ARBs. They work extremely well in lowering blood pressure, and very few people, if any, have any side effects to the angiotensin receptor blockers. They have a very specific target, which is the angiotensin II receptor and vascular smooth muscle that relaxes the blood vessels, which lowers the blood pressure. So they work very well. There are several conditions which can make treating hypertension difficult. One is chronic daily alcohol intake. Drinking alcohol every day in quantity can make it very difficult to control blood pressure. Another is obesity. Being extremely overweight makes it more difficult to treat hypertension. And the third one is tobacco use or nicotine use, even the vaping pen. Nicotine is very vasoconstrictive. It makes your blood vessels constrict, which increases the peripheral resistance that the heart has to pump blood against, and so that elevates the blood pressure. So those three things, chronic daily alcohol intake, obesity, and tobacco or nicotine use, can make hypertension more difficult to treat. So if you're above the age of 50, make sure you get annual checkups to check on your blood pressure. And if you have hypertension, make sure you get regular visits with your primary care physician so they can adjust your medicine to keep your blood pressure under control, because you want to avoid ischemic heart disease, myocardial infarction or heart attack, and certainly you want to avoid stroke or decrease your stroke risk. And you do all of that by controlling the blood pressure. I hope this information was of benefit to you, or if you know of someone who could benefit from this information, please send this along to them. Be sure to like, share, and subscribe to this channel, because I'll be posting new information and you'll be notified immediately when new content is delivered. Also, Life After Work publishes a free newsletter, and you can find that at lifeafterwork.co, lifeafterwork.co, and there will be a link in the description box below. Until next time.